So this afternoon then we're moving, I suppose, shifting perspective a little bit, but building on some of the themes and discussions of the morning. So in the morning there was a lot about thinking global, and now we're going to be into, I suppose, looking at various things from maybe more from the patient perspective. And I think, as Bernard said this morning, we're all in one way or another patients, so it's something that should resonate with us all. World Patient Safety Day today is obviously one of the campaigns under the WHO Global Action Plan, and Ireland participates in WHO global reports. So, like as Demi showed us this morning, it allows us to see where we are vis-a-vis other countries, how we're performing within the global context, and then who can we learn from, or perhaps share learning from in that. So part of what we're here today, and I think we may be one of the first countries to do this at a big public event, is the new Patient Safety Rights Charter, which was published by the WHO just very earlier this year. It was developed under that global plan to help support implementation. It was developed in collaboration with patients, with families, with carers and communities. So you might have seen the charter out in the lobby today. It's on your lanyard, in your bags. They're the 10 rights of the Charter. There is a longer document available on the WHO website. And I suppose part of it gives us an opportunity to stop and reflect. Some of the content may not be new, it's maybe expressed in a different way, but I think when we come together, as we do at this conference or other events, is a time to kind of pause and reflect and renew our commitment to patient safety. So in a few moments we're going to have, I suppose, a piece with digital health being one of the themes, where we will digitally, for anyone who hasn't already signed the boards in the lobby, and please feel free to take a photo or anything with them, to digitally sign up to the Charter. So as I said in the morning, phones on silent. Please continue on social media. I think we're trending number 2 in Ireland, only behind the ploughing. So hashtag NPSO 2024. If we pass the ploughing out, then we really have made it. But I can talk about the Charter. We might all have a perspective on the Charter, but I'd like to introduce, I suppose, for a very unique and important perspective on the Charter, and what it means from a patient perspective, and why having something like a Charter is really important in, I suppose, our toolkit of all the things that we use on and lean on to try and improve patient safety. So I'd like to introduce Bernie O'Reilly, Chairperson of Patients for Patient Safety Ireland, to talk about the Charter from the patient perspective. Thank you, Bernie.
Thanks. So as Kate has already said, I'm the current chair of Patients for Patient Safety Ireland, which is a WHO group of volunteers who share their experience of healthcare in the name of patient safety improvement. As well as sharing our own stories, we also champion WHO improvement measures. So World Patient Safety Day is a focus day for our group, and we are delighted to be here at the National Patient Safety Office Conference today. Now, otherwise I would be at the Ploughing Championship, but because I'm from the farming community, but I mean, a gig is a gig, and I'm happy to be here. I was actually at the ploughing last year, and I got so wet and so mucky, I think I told my daughter I wasn't coming back for a long time. So a beautiful sunny day, and I'm delighted to be here. The support our founding member, Margaret Murphy, received from Dr. Philip Crowley, who was here earlier on, and his team opened the door to 11 years of people donating their time, sharing their experiences to work hand in hand with our health service. Our group has grown, developed trusted relationships, proved that patient engagement is how we build a better, safer health service that listens to and acts on the feedback of people who use it. The opportunities we get require support from people in the HSE, like Chief Clinical Officer Colm Henry, like Dr. Orla Healy and her team in the National Quality and Patient Safety Directorate, and our department officials, Kate O'Flaherty and Rachel Kennett, Chief Nursing Officer, and a whole host of other people. Really, for every member of our group who engage, there are many other people who work with us and make patient partnership happen. When I was asked to be co-chair of the HSE World Patient Safety Day Committee, I did so in the knowledge that collaboration was the connector of a team of people, and I want to thank and acknowledge them all, Most of all, I want to thank Patient Safety Ireland members. Without the generosity of their volunteering, we wouldn't have a group at all. So I think 11 years of that kind of engagement just proves the worth of patient engagement. When we mentioned the WHO Patient Safety Rights Charter, Kate was very quick to say that the Department of Health always have their finger on the pulse of WHO guidance, and Kate was particularly encouraging in making the Charter part of today's agenda, so thank you, Kate. So now to why I'm standing up here feeling like a rabbit in the headlights of a car. I'm going to give you my introduction to the WHO Patient Safety Rights Charter. So the Charter came about as a support for the WHO Global Action Plan, which runs from 2021 to 2030, which sets out at eliminating avoidable harm in healthcare. The work of the Charter started this time last year with World Patient Safety Day, which had the theme Elevate the Voice of Patients, which enshrined the importance of patient and family engagement, equality, dignity, access to information and risk management into the principles and practices of patient safety. A sizable amount of patient harm is preventable. Apparently 1 in 10 people are harmed in healthcare, and we all have the right to, to receive the best possible care. So it's quite shocking to realise that about 50% of patient harm could be avoided. So while lots of really great things are happening, there's always more to be tackled, and the target audience for the Charter is everybody. Sometimes things are geared at frontline people, and I think that's a burden on them because most of them are already really trying their best. So this Charter is really aimed at everybody. When I first read the Charter, I thought that Ireland didn't have much to do because we have a developed healthcare system, and maybe it applied to poorer countries, deprived countries, but it's actually valid worldwide. The devil is in the detail. It speaks to everybody. It might speak to me in a different way than it speaks to you, like things jump out at me because of my own life experiences, and the same for you. Your own life experiences will have a bearing on what you see in the Charter. All that is good in our healthcare service stands out, and we are proud of it. So I'm thinking that the value of the Charter is in stimulating improvement, so tackling some of the things we can do better. So read the Charter statements. As Kate said, there's a whole background document to them, and there are short explainer paragraphs for all 10 points of the Charter, and just consider how they speak to you. So the Patient Safety Rights Charter is comprised of 10 statements. So the first one is right to timely, effective, appropriate care. So I'm now the wrong side of 60. I'm kind of cruising towards 70, and I was a low user of health services, but as I age, I guess I'm going to be a more frequent flyer. So things like being able to get my GP in a timely way, and it's quite difficult in some areas now. You can often have a 3-week wait for a GP, and as you age, your problems are probably going to become more urgent to you because you think, well, I've been lucky so far, I mightn't be as lucky this time around, so I need to see my GP fairly, promptly. So when I meet my GP, I want to think that my file is available to him and all my details are on his computer, and that, that information, that free information, and as much information as he can have on me is important. Things like clinical deterioration and failure to rescue feature under this right. And my husband died of sepsis, which began and ended in a hospital over a period of 3 days. So clinical deterioration following elective surgery and failure to spot sepsis in time to save his life was actually, really the end of his patient story at the end of his life. The next point is the right to safe healthcare processes and practices. Infection prevention and control, for example. I'm delighted that our stand outside is beside Amric, who do fantastic work around infection prevention and control. Also things like overdiagnosis and underdiagnosis, and touching on the theme of today's World Patient Safety Day, improving diagnosis for patient safety, getting it right, making it safer for everybody. The next point is the right to qualified and competent health workers, and I'd add on to that, and enough of them, so that they're not stretched to breaking point. Our healthcare professionals and our healthcare frontline workers have to be on their best in every engagement with a patient, because that's what keeps the rest of us safe. So if they're not, well in themselves, or they're overstretched, well then they're not going to be able to care for the rest of us. The right to safe medical products and their safe and rational use. My husband's death certificate cites failure of a medical device, So that's one that definitely speaks to me. And medication safety comes under this right. And as the most used intervention of patient care and a major cause of harm, medication safety is high on the list of where much work needs to be done. So starter measures like keeping our own medication list to, I suppose, cover the gaps, between our exchanges, and to have a handle on our own medication and bring our medicines list to healthcare appointments rather than depending on your own memory. It's very helpful to have it written down in front of you, and very helpful for the healthcare, your doctor or your healthcare the person you're engaging with, to have that information. Safe and secure healthcare facilities, I see plenty here too from many angles. No one should feel unsafe where the environs come under the words healthcare. Not patients, not staff. Abuse and violence might spring to some minds and to mine. My elderly uncle was attacked by a fellow patient and thankfully was rescued by staff members, but it terrified him and he was never at ease in hospital again. So, they're difficult situations. Healthcare staff can be the targets, so abuse and violence needs careful management. Zero tolerance if it stems from those who know what they're doing, and supports when it comes from those who don't. Like sometimes people who are unwell could be violent or a bit belligerent, but they don't know they're doing it. But you just have to manage these situations as best you can to make things safe for everybody. The words unsafe also extend to hygiene in healthcare settings, giving rise to increased infection dangers. When I was patient representative on the National Public Health Emergency Team for Superbug CPE, which preceded the NPHET for COVID, where NPHET became a family. Everybody in the country started to know what NPHET was with COVID, but there have been previous NPHETs, and the one I was on was about CPE. I discovered that CPE loves unwashed hands, but it also loves blocked drains, so it finds its way up the shower trays, up the sinks, and up the toilets in hospitals to get at its host, which is me and you. And so, like, all those infrastructural things need to be kept right to keep our superbugs at bay and to keep people safer. So, in other words, if you see dirt, act on it, report it, and don't forget hand washing. It's a major deterrent against dirt, bugs, and all sorts of infections. The right to dignity, respect, non-discrimination, privacy, and confidentiality. These are all rights which are based in kind of human rights, so they're not new concepts to us. We just are viewing them through the lens of healthcare. The right to information, education, and supported decision making. This particular right is very grounded in patient empowerment. Your right to your own information. Our health service does not own our information; we own it. So we have a right to understand our healthcare, we have the right to ask questions, to have it explained in plain language, the right to make our own informed decisions with assistance if you need it, and just enough to help you, not to overpower your decision-making ability, but to assist you if you need it. And this brings me to health literacy, and I believe the seeds to a step forward we need to take is making health literacy part of our education system. Before people become patients, like educating our young to understand their own health and well-being, make wise choices to sustain good health, and how to use health services in a sustainable, effective way if health challenges arise. We must also keep all the current channels of health literacy open and working in our communities and across our healthcare facilities, as well as in the hands of those who traditionally provided much of our health learnings, which are our healthcare teams. Use whatever resources help this happen, including new ways. Good communication will always be at the heart of this, but there's nothing like a health challenge to undermine even the most articulate person. Our ability to absorb information and think clearly gets a real knock when we're worried about our own health. So prompts help. Use whatever works for you. Thinking and writing down in advance things you want to discuss at your healthcare appointment, to ask questions, writing down what you have to do next to progress your journey, and things like the new HSE leaflet, My Health, My Voice, they're all aids to help people. So use whatever works for you, whatever is accessible to you, but it's definitely whatever helps you articulate and understand your health journey. The next one is the right to access medical records. This ties in with the previous. Patients have the right to access and copy and obtained a copy of the records in a usable and understandable format. This includes physical and electronic records that are accurate and up-to-date, and the use of IT solutions and the success of large projects currently in progress within the HSE, such as the shared care record and e-prescribing. And moving this agenda forward, the patient must always be at the centre of IT and, be aided to understand IT solutions and provided with alternatives if they don't understand the digital platforms, which not everybody does. Records should not be restricted to just medical records. Sometimes there are other records which help patients and their families process situations, particularly adverse events. The right to be heard and fair resolution. This is what the Charter of Rights says. Patients have the right to share their experiences, file complaints and report safety incidents during their care. This includes adverse events leading to patient harm, near misses and other safety risks they perceive or safety concerns they may have. Patients are to be provided with a supportive environment rooted in the culture of safety, whereby their voices are heard and their concerns expressed without the fear of retribution or negative repercussions. In the event of an incident, patients are entitled to clear explanations about what happened, the reasons behind it, the actions taken for redressal, fair resolution and prevention of reoccurrence. Patients also have the right to be involved in fair and just process for addressing any harm experienced. This involves a clear pathway for independent investigation, accountability, reconciliation and fair resolution, including compensation in line with harm experienced, national legislation and best practice, appropriate mechanisms for reporting safety incidents and systems to learn from these incidents. That is so important, the learning that we get from incidents like that. That's what makes our system safer going forward. In cases of serious incidents, patients are entitled to receive ongoing psychological and other forms of support as needed and should be reassured that the healthcare facility is committed to implementing the learning from incident analysis and improve the safety of care and prevent future occurrences. And I think we've made great progress in all of those things, but there's still obviously more to do. Observing and being immersed in the dialogue concerning open disclosure with the Patient Safety Act 2023 nearing commencement, I believe in the right to be heard and fair resolution. We all own our own honesty, and it starts with being honest with ourselves and sharing it with others. And supporting others in applying honesty as well. So, it's not, I think that colleagues should support colleagues. I think, there needs to be a supportive environment around the enactment of the Patient Safety Act. Because, with anything new coming at us, it's a time when you don't know what to expect and a little bit of fear may be thrown in. And I think we just need to be supportive of each other. A culture of open disclosure depends on supporting honesty. I also feel that as agents of the state, that our healthcare professionals and workers, they're entitled to all the supports required to protect them, to be honest in an environment where we have a litigious society, and there are. I do think that the honesty that's required of people needs to be supported. So number 10, the right to patient and family engagement, pretty much the foundation on which patient safety was built and the focus point of everything we have volunteered to champion for over 11 years. The 6 new health regions have the opportunity to take patient and family engagement to a new level, and members of the group I am in get lots of opportunities to engage, as do people in the HSE Patient Forum and the HSE Patient Panel, but that's a small number of people in the context of 5.5 million people in Ireland who might use health services at any time. Most of those people have never heard of patient and family engagement. Very few people have the time to join focus groups in the middle of the working day and the traditional routes that we have to engaging, or become patient partners on national steering groups and committees, and will perhaps find it all rather daunting. None of us can speak for the people of Ireland, so across the 6 health regions, new ways of really engaging with people is necessary. Find service users where they are. You know, in the waiting rooms of Irish healthcare facilities all over the country, quite often people are sitting there for hours and with not a lot to do, only wait. So if you use new ways of connecting with them, use the screens, which, as Tibbs alluded to this morning, sit and watching reruns of Fair City and Corrie and whatever else comes up on those screens. It's not exactly riveting information, and a bit of a lost opportunity. Like, you know, we can use those screens to inform people and run a few healthcare videos in the mix. So use the waiting room resources as ways of connecting with people and get their ideas for what would improve their experience of healthcare and close the loop. People need to see that their input has changed something and made it better. So I'm asking you to find what you can do, sign up to the Charter, and I want to see the Minister's signature in there as a mark of leadership with the rest of us, because we all count. So please sign the Patient Safety Rights Charter, and as I've already said, it's based on human rights and something we should all be supporting. Thank you.